What is coronary arterial disease? Medium. Globally, coronary heart disease or coronary artery disease or CAD continues to be the primary cause of morbidity and death. This disorder develops when plaque, which is a buildup of cholesterol and other materials, narrows or obstructs the coronary arteries, which are in charge of providing blood to the heart muscle. Anatomy and anomalies of the coronary arteries. The left and right coronary arteries are the two primary coronary arteries that supply the human heart. The left anterior descending artery, LAD, and left circumflex artery, LCX, are the two additional branches that arise from the left coronary artery. The heart's right side is predominantly supplied by the right coronary artery, RCA. Although this structure is normal, there may be differences and abnormalities that impact the genesis and trajectory of these arteries. These abnormalities are important because they may change the heart's blood flow and put people at risk for coronary artery disease, CAD. CAD presentations and symptoms. The most prevalent sign of coronary artery disease, CAD, is angina, which is a form of discomfort or pain in the chest brought on by decreased blood supply to the heart muscle. It's common to divide angina into stable and unstable forms. Stable angina, usually brought on by physical strain or stress and treated with nitroglycerin or rest. Unstable angina is more severe, occurs more suddenly, and can occur while at rest. This is an alert that a heart attack is about to happen. EKG changes in CAD. The diagnosis of various kinds of CAD is largely dependent on changes in the electrocardiogram, EKG. They assist in recognizing both typical and anomalous patterns like the hallmark of an ST elevation myocardial infarction, STEMI, is a marked elevation in the ST segment of the EKG leads that corresponds to the afflicted heart region. Non-ST elevation myocardial infarction, NSTEMI, initiated by T-wave inversions or ST segment depressions, these abnormalities signify less extensive myocardial injury. Various heart attack types and ECG presentations. Anterior, MI, affects the anterior region of the heart, typically the left anterior artery. ST elevation is seen in the precordial leads, V1, V4 of the EKG. Lower cardiac damage known as inferior MI is frequently associated with the RCA. ST elevation is seen in leads 2, 3, and AVF on the EKG. Lateral MI, affected area of the left ventricle's lateral wall, frequently connected to the LCX artery. ST elevation is seen in leads I, AVL, V5, and V6 of the EKG. Back of the heart is affected by posterior MI, which is typically associated with the RCA or LCX. Tall R waves and ST depression may be seen in V1, V3 of the EKG. Treatment. A mix of pharmacological, lifestyle, and potentially surgical therapies are used to treat CAD. Aspirin, beta blockers, ACE inhibitors, and statins are examples of common drugs. Procedures such as coronary angioplasty or coronary artery bypass grafting, CABG, may be required in more serious situations. Examine and diagnose. When diagnosing CAD, coronary angiography is considered the gold standard. It entails looking at the blood vessels in the heart using X-ray imaging, which aids in identifying any irregularities or blockages in the coronary arteries. Effective care of coronary artery disease necessitates a deep understanding of this complex disorder with a wide range of presentational characteristics. It's critical to speak with a healthcare provider if you think you may have CAD symptoms in order to receive the right diagnosis and treatment.